Welcome to our Molecular U series on case studies. My name is Ash Anwar. I'm the Senior Director of Scientific Research and Development here at Molecular U, and I'm very excited to continue to showcase various patient case studies with you to highlight the power and comprehensiveness of the Molecular U test. The second patient we are going to cover today is patient R. Patient R is an individual in her mid-80s. She has no pre-existing conditions, however, is suffering from a number of symptoms that are debilitating right now. She suffers from significant chronic fatigue, as well as occasional joint pain, joint stiffness, as well as frequent swelling in her joints. She also suffers from a high degree of muscle aches and soreness. And when she has taken this information to her doctor and has done clinical blood work, her doctor has very often dismissed these symptoms as potentially more a sign of old age. So, mostly wear and tear potentially. If you look at her blood biochemistry right over here, you could see that the clinical blood work is not really indicating anything definitive for us at this point. So we can see here in the hematology that there is her RBC count is a little bit on the lower end. Her MCV is a little high. So the combination between this low red blood cell count as well as high MCV could suggest anemia, which is often could be caused by some sort of a chronic illness or bone marrow dysfunction, but the clinical lab test is not really giving us any sort of indication or direct indication on this. If you look at the differential and the number of different white blood cell counts as well here, it's all within normal ranges. Her general chemistry shows that her glucose levels are normal as well as her GFR are normal as well, indicating that her kidney function, based on this clinical blood work, is normal. However, when we look at her molecular U test, her molecular U test reveals a significant high risk in rheumatoid arthritis. You can see her rheumatoid arthritis score here in the red, as well as her liver disease score here in the red, indicating that there is a high risk to her liver health. When we look at the other biomarkers that are also quite elevated, we can see a significant number of them are associated with the immune response. So biomarkers like beta 2 microglobulin is a very significant immune biomarker, as well as the complement C1q. Both ficolin 2 and ficolin 3 are also immune associated biomarkers as well. So her profile shows a high degree of immune dysfunction as well, leading to this higher risk in rheumatoid arthritis. If we take a deeper dive and look into the specific biomarkers and how they're involved in her system, we can see and understand that immune dysfunction is very apparent in this patient. Her high levels of beta 2 microglobulin, which is a cell surface protein, indicates that there is an overproduction of white blood cells. Her higher levels of innate immune system proteins like complement C1q, like ficolin 2 and ficolin 3, these are all immune system proteins and quite high and elevated, indicates that there is a high level of persistent inflammatory activity in her body, as well as a hyperactivity in the immune system. So there's overactivation in her immune system, consistent with this high risk of rheumatoid arthritis. She also has, in our molecular U test, a high level of creatinine, which is a byproduct of muscle metabolism. And these high levels in her blood indicate a risk for poor kidney function that we are seeing in her results. So she also has a low level of glutathione peroxidase 3. Glutathione peroxidase 3 is an antioxidant protein. It's a very significant antioxidant protein. The low levels in her body indicate that she must be under a significant amount of consistent oxidative stress. And this oxidative stress is leading to the depletion of this protective enzyme. So patient R took her results, her molecular U results, and went back to consult with her doctor. Based on the molecular U results, that we are seeing a high level of immune dysfunction and immune hyperactivity, as well as a high risk of RA. The doctor decided to perform a number of autoimmune tests. So the doctor ordered an ANA test, did a physical examination, and other autoantibody tests. The physical examination resulted in the discovery that she also has dry mouth and dry eyes. The ANA test and autoantibody tests for Sjogren's disease came back positive, which indicated to us that she was diagnosed with Sjogren's disease, and the doctor confirmed the diagnosis of Sjogren's disease. And Sjogren's is an autoimmune condition that specifically targets the tear ducts in the eyes, leading to dry eyes, as well as the salivary glands in the mouth, leading to a dry mouth, but also is a contributor to severe chronic fatigue and other autoimmune conditions. In Sjogren's, there is a possibility of kidney involvement, so there is going to be a consistent analysis and evaluation of her kidney function moving forward, as molecular U has been able to identify kidney biomarkers being elevated here as well. And Sjogren's also comes with a risk of a number of secondary comorbidities, one of them including rheumatoid arthritis. And the molecular U test was identifying rheumatoid arthritis, or RA, as being elevated risk. So that is also potentially the cause or the reason behind her swollen joints and potential high degree of inflammation targeting her joint and leading to lower mobility in those joint areas as well. So this is something that confirms the secondary condition of RA based on Sjogren's as well. And one of the things we recommended as a follow up is to continue to test and monitor her levels of beta 2 microglobulin. And the reason for this is beta 2 microglobulin is not only a very important biomarker for autoimmune conditions like Sjogren's and rheumatoid arthritis. However, elevated beta 2 microglobulin is also a very important biomarker for cancer, specifically lymphoma. So, being able to monitor and see where her beta 2 microglobulin levels go towards in future tests will help us assess her risk for potentially developing cancer in the future.